How do you exercise a rheumatoid arthritis swollen, inflamed, and painful joint so that it doesn't irritate it? That's what we're going to talk about in this video. My name is Clint Patterson, creator of the Rheumatoid Solution System and the Patterson Program for Rheumatoid Arthritis, and this is what we help people with every single day. So if your joint is inflamed and the joint has an increased amount of swelling and tenderness, then we need to be careful that we don't irritate it through exercise. However, we want to exercise because all of the scientific literature and all the experience I've had personally in working with thousands of others has revealed that exercise is beneficial for our joints. We don't want to take a week off, 2 weeks off from exercise if a joint hurts during that period, because it's only going to create an incremental deterioration of the cartilage and become a worse joint overall. The solution is to exercise the joint on those days that they are more irritated using a reduced range of motion. So we don't want to push a joint through an extremity either in the flexion or in the extension range of motion. So how might we do this? We might do this with one of these grip strengtheners using an isometric grip. Isometric just means that we don't go through any range of motion at all. We just hold a single position. So these are adjustable and you might want to increase the tension, and then you just hold and squeeze. We hold and squeeze, 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 and relax. And then hold and squeeze, 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 then relax. So if you look at what's going on, we've got our hand pretty much in a fixed position. And by keeping it in a fixed position, it is protecting that joint. We can squeeze hard, even in a fixed position, without irritating that swollen joint. Likewise, if it were a knee that were affected, we can do an isometric squat. That's getting into a position, holding it, and then coming out of it again. We might hold it for 10, 20, 30 seconds. We might even hold it for a minute. Even better would be to do one leg at a time so that we also watch our balance. And that's my preference, is to do one leg at a time when we have knee problems. So this is the approach. We don't not exercise. We just use a shallow range of motion, and taking it to an extreme is to do an isometric or just single position engagement of the surrounding tissue, including the tendons and also the muscles. Doing this gets some engagement but doesn't irritate the joint. If you need some help in this area, check out the upper body workout and the lower body workout inside our members area. Go over to rheumatoidsolutions.com where you can get started. Otherwise, I'll see you in the next video. Hope this helps.